This isn't the welcome you'd want at any airport. Passport control is now containment control here in Daegu in South Korea. This deep clean takes place both inside and out, in a country with the largest number of novel coronavirus cases outside of China, now at nearly 7,000. This is what COVID-19 has done to a Saturday morning in South Korea. The cases aren't just rising in Daegu. Here in the UK, 43 new cases were confirmed today, bringing the total to 206. The family of a COVID-19 patient who died yesterday in Milton Keynes said in a statement that they had lost a wonderful husband, dad, granddad and great-granddad, adding that whilst he may have tested positive for having the virus, it has not been confirmed what the cause of his death was. Globally, there are now more than 100,000 cases across more than 90 countries as cities and streets slowly empty. Faith offers no protection from this virus. Here in Mecca, the cleaners were out in force at the Grand Mosque. To Bethlehem in the West Bank as it begins a 30-day lockdown. And Pope Francis will live stream tomorrow's Sunday prayer to avoid people gathering at the Vatican. And to Africa, where a cruise boat on the Nile is now in quarantine after 12 people tested positive for COVID-19. A situation reflected off the coast of California, where 21 cases were confirmed on the Grand Princess. Among those on board is 60-year-old American Carrie Colstow, a retired teacher and cancer patient who hopes to reach land before her medication runs out.
The captain didn't tell us until half an hour after it was on the news. He said that he didn't have permission to do so. Right. And I don't even think that the specific people necessarily know which ones have it and which ones don't.
Americans like Carrie look to their president for answers. When asked what should happen to those on board, Donald Trump, clad in re-election merchandise, focused instead on the numbers.
They would like to have the people come off. I'd rather have the people stay, but I'd go with them. I told them to make the final decision. I would rather, because I like the numbers being where they are. I don't need to have the numbers double because of one ship.
He's put his vice president in charge of his government's response, with Mike Pence saying the Grand Princess will be brought to port and everyone would be tested. As cases rise and the news spreads, caution is setting in. Like for these shoppers in Hampshire, keeping calm and stocking up on toilet roll. In Australia, the scenes were less sedate.
I just want one pack. No, not one pack.
At this point in time, we just ask that people don't panic like this when they go out shopping. There's no need for it. It's not the Thunderdome. It's not Mad Max.
Those seeking safety off the shelves should remember that today, China reported its lowest daily increase in coronavirus cases in 7 weeks. The World Health Organization said that that decline should be a source of encouragement for other countries as they try to contain the virus's spread.
Well, earlier I spoke to Dr. Chand Nagpal, who's a GP and chair of the British Medical Association Council. I began by asking him if the UK was still in the containment phase.
We are at the moment officially still in containment phase. That doesn't mean that some of the measures around delaying spread should not be happening. So we are seeing efforts made to try and ensure that the disease doesn't spread. Efforts made in some cases, some organisations are cancelling unnecessary gatherings of workers, conferences, and that of course would become very much policy in a delayed phase, but at the moment many are taking those precautions at an early stage.
Are you happy to see things like Cheltenham races go ahead next week? It's a gathering of a lot of people in a relatively confined space. What do you think about that?
I think each event has to be considered on an individual basis. I think I'm going to be guided by what is a balancing act between experts looking at the trend of spread, balancing that against the inconvenience of putting a standstill to normal functioning.
That decision could come within days, you think?
It could come within days, yes.
There is conflicting advice on masks, isn't there? If doctors are requiring masks, what would you say to people who are worried about travelling on public transport, crowded public transport? Would you say that at some point it would be advisable for them to wear masks too?
At this moment in time, there is no recommendation for the wearing of masks in order to go outdoors, to travel. We know that the standard surgical masks don't really protect, so you could actually have a false sense of assurance and think you're protecting yourself, but you're not. What's shown to be much more effective are the personal hygiene measures, such as washing your hands with soap, including, for that matter, making sure that you're not too close to others.
There is a lot of a difference of opinion between medical experts about how worrying this outbreak is. We had on our programme last night a scientist, Dr. Richard Hatchett, who said it was the most frightening disease he'd ever encountered in his career. Today, there was evidence from a Canadian infectious disease specialist saying he's not scared of the virus, but he's scared of the panic about it. Where do you stand on those two different views?
I think we have to be rational, and being rational is rightly to be concerned and vigilant, because we know that this virus can have very severe medical consequences on those patients who are vulnerable with medical conditions and with the elderly. So we can't be complacent, but equally what we should not be doing is creating fear and panic and alarm.
Would you also be asking the government, the budget's coming up, for extra resources to help you manage this crisis?
We need to see a real injection of resources in hospitals, GP practices, in social care, because if this virus takes a hold, we're going to need to really have that greater capacity to look after many more acutely ill patients. The health service, we believe, even before the crisis, was short of several £billion per year, compared to nations like France and Germany. If you actually look at even our critical care beds, Germany has 4 times as many as we have per 1,000 patients.
Dr. Jean Nagpal, thank you very much.
Thank you.
Now, 3